We'll talk about two issues of the spine this morning, and one is what is known as the ossification of the posterior longitudinal ligament. The other one is what? Ossification of the ligamentum flavum. So the thing is very simple. If you know your anatomy well, you know where the posterior longitudinal ligament is located, and basically it's kind of like, behind those neck bones. Do you understand? Behind the neck bones. All right. Can I see when it's calcified? Ossification. You have deposition of calcium, and over time this flexible ligament is becoming very stiff. Then the ligamentum flavum is all about you knowing where the ligamentum flavum is. Do you understand? So just so you knowing that there could be ossification there. The ligament could move from being so flexible to being so stiff. Now what we have is this. Ossification of the posterior longitudinal ligament, first of all, is where the posterior longitudinal ligament of the spine is gradually turning into a bone. So a ligament is supposed to be a ligament. There's a way nature made it like that. Do you understand? So that flexibility. So the ligament runs along the back of the vertebral bones inside the spinal canal. I saying this, okay? So you have the spinal canal where what? Your bundle of nerves are passing. So if this ligament is becoming stiff, it can also even impinge on your spinal cord, causing a lot of issues. So what's the epidemiology? Is most common in East Asian populations, especially men, and it often affect the cervical spine. That's up in the neck. Do you understand? Going down the spine, you hardly have issues like that, but it can also occur in the thoracic and also the lumbar regions. Okay. So symptoms: a lot of pain and stiffness, and when depending on the nerve, the section of the spinal cord that is what compressed. Of course, for different sections you have different effects. All right. So diagnosis is X-rays to show the ossification, and just so you know, CT scan is always the gold standard. Then MRI can also access the spinal cord compression. Treatment is, if it is mild, observe. If it is severe, you have to do surgeries like laminoplasty, laminectomy, just to increase the space between the ligament and also the spinal cord, because the ossification is not really a problem, but it's impinging on the spinal cord is actually the issue here. Therefore, the ligamentum flavum and its ossification, you could quickly spot out the ligamentum flavum there. And you can see that it also lines where the spinal cord will pass. Do you understand? So it's similar in nature, but it actually involves the ligamentum flavum. All the effects we discussed in that other one, you can have it here. That's why we are discussing the two conditions together. So epidemiology is also common in East Asians. But this one, instead of commonly occurring along the cervical vertebrae, you have it commonly occurring along the thoracic vertebrae. So symptoms is thoracic myelopathy. You have difficulties in walking, spastic gait, weakness, sensory changes. So you diagnose it using MRI or CT scans. Then for surgery, you have to decompress. Let me say, if it is ossifying, it will now occupy so much space that the spinal cord is occupying. So you do a surgery to actually cut it out. Okay. You take away the compression. Okay, so to say, you decompress.